It was billed as an informational hearing. Health and public policy experts told the House Health and Human Resources Committee contact tracing doesn't work. Arizona's first COVID case was probably in November, and the number of people infected might be much larger than they may have thought. Their conclusion? The impact of COVID-19 is either overblown or unavoidable. By May 16th, every business that can will be allowed to reopen in Arizona. The transition back to work comes at a time when data shows the number of COVID-19 cases and deaths are up, but the levels are stabilizing.
The number of confirmed cases are a really poor proxy for the extent of infection in the community.
Dr. Niraj Sood was one of 5 experts who testified before the Health and Human Resources Committee. His Stanford research team concluded for every person diagnosed with COVID-19, 50 more have the virus. He is not alone in that thinking.
I'd urge you in your thinking about this to count lives on both sides of this, not just the COVID lives, but also the lives of the people that are hurt by the lockdown. It's lives for lives, not just lives for dollars here.
Democrats who had urged a slower course are concerned going back to work too soon increases the risk of the virus returning.
The uncertainty in how this plays out is what's causing us the most amount of heartburn. In Arizona, we have to think about the resources we have and ask ourselves, okay, even if there are certain amounts that we don't count, are we going to overwhelm the system? Because I don't know, tell me if you'd agree, but everybody over that point of saturation ends up with a really terrible mortality and a terrible outcome.
The experts all agreed residents of nursing homes and assisted living facilities are extremely vulnerable to COVID-19. About 50% of the deaths in Arizona are residents of those facilities. They encourage lawmakers to find out why that's happening and do something about it.